Welcome back to my YouTube channel Medico Voice. Today's topic is pathological calcification. So, what do you mean by pathological calcification? First of all, the word pathological means abnormal tissue or cell, and calcification means deposition of calcium in the tissue. Pathological calcification overall can be said that deposition of calcium salt in the tissues other than ostid and enamel. Ostid means bone and enamel is present in the teeth. That means normally there is physiological calcification in case of bone and enamel, but if calcium salt deposited in other part of our body, in other tissues of the organ of our body, then that will be called pathological calcification. Pathological calcification, also called as heterotropic calcification, because it can occur in different part of our body, different organs of our body. What are the types of pathological calcification? First one is dystrophic calcification and the second is metastatic calcification. First, let's discuss dystrophic calcification. In case of dystrophic calcification, calcium deposition occurs in dead and degenerated tissue. That means calcium deposition occurs only in the necrosed tissue, only in those tissue that is degenerated, dead and already necrosed. Otherwise, calcium metabolism and serum calcium level of our body in case of dystrophic calcification remain normal. Only problem is in the tissue, that is the tissue is degenerated and that will form a favorable site for the deposition of calcium and causes dystrophic calcification. Let's take example of dystrophic calcification. First one is caseous necrosis. Caseous necrosis is a cheese-like appearance of necrosed tissue. We can see caseous necrosis in case of tuberculosis of lung. In case of tuberculosis of lung, there will be cheese-like appearance of the necrosed tissue in the lung, and due to formation of necrosed tissue, the calcium deposition will occur easily because necrosed tissue form a favorable site for the deposition of calcium. The next example of dystrophic calcification is liquefaction necrosis and fat necrosis. Liquefaction necrosis means the solid structure of the tissue converted into liquid. That means the outer architecture, outer membrane of the cell is distorted, totally dissolved, and the solid form of cell and tissue converted into total liquid form. We can see liquefaction necrosis in case of chronic abscess formation. And fat necrosis occur in fat-rich areas of our body, like in case of pancreas and breast. Fat necrosis can be seen in pancreas in case of acute pancreatitis and in breast in case of fibroadenoma. Third one is venous thrombus. Thrombus means blood clot. Blood clot form inside the veins and remain attached to the wall of vein. But when this thrombus detached from the wall of vein and come in the blood circulation, that will be called as emboli. The formation of thrombus inside the vein form a favorable site for the deposition of calcium there, and this will cause dystrophic calcification. The other example is atherosclerosis. Atherosclerosis means thickening of the wall of artery due to deposition of cholesterol in the wall. Due to deposition of cholesterol, automatically there will be deposition of calcium as well, and this will also come under the classification of dystrophic calcification. Next one is gamma-GANDY bodies. Gamma-GANDY bodies are also a form of calcium deposit along with hemosiderin. Hemosiderin is a type of iron pigment, and This gamma-GANDY bodies is formed due to chronic venous congestion of the spleen. That means due to congestion of the veins of a spleen, there will be deposition of calcium along with hemosiderin in the veins of spleen. Next example is dead parasite. Due to dead parasite, there will be deposition of calcium as well. Like in case of hydatid cyst is also a form of calcium deposition that is caused by the death of parasite Echinococcus granulosus. Echinococcus granulosus is a type of parasite which help in formation of hydatid cyst. Similarly, other parasite we can say Tinea solium. The larva of Tinea solium forms cysticercosis, which is also a form of calcium deposit. Next one is MONCKENBERG's sclerosis. First of all, let's see the meaning of sclerosis. Sclerosis means hardening of the tissue in arteries. In case of MONCKENBERG sclerosis, there will be hardening of tissue in arteries, mainly tunica media. Arteries usually have three layers, that is tunica externa, tunica media and tunica intima. And MONCKENBERG sclerosis usually seen only in tunica media. The next example of dystrophic calcification we can see is congenital toxoplasmosis. The name congenital is given because it can be transmitted from mother to child during pregnancy, and it is usually seen in case of infant. Infant means the child of up to 1 year, and child up to 1 month we call them neonate. And toxoplasmosis. Toxoplasmosis is caused by the parasite Toxoplasma gondii. So congenital toxoplasmosis means there will be calcification of central nervous system tissues in infant brain. Next example is Psammoma bodies or calcospherite. With the term calcospherite only we can say the meaning. Calco means calcification and spherites means spherule-like. So the spherule of calcification occur in case of meningioma, ovarian carcinoma and papillary carcinoma of the thyroid. In all these cases of cancer, there will be deposition of calcification in the form of spherules, and that we call it Psammoma bodies or calcospherites. Next example of dystrophic calcification is calcinosis cutis. Calcinosis means artificial deposition of calcium and cutis means skin or subcutaneous tissue. So calcinosis cutis means irregular nodular deposition of calcium salt in the skin and subcutaneous tissue. There will be nodule-like deposition of calcium in the irregular form. That means the size of nodule is not fixed. The nodule size will vary and irregular in shape. Now come to pathogenesis of dystrophic calcification. As we all know that dystrophic calcification only occur in case of necrosed tissue, and for necrosis there will be hypoxia or cell injury. So in case of cell injury, the membrane of the cell get damaged and phospholipid comes out, because phospholipid is a component of the membrane of cell, and phospholipid gets broken down into phosphate and lipid. And we also know that in the membrane of cell there is a calcium channel pump which help to remove excess calcium from the cell, because free calcium inside the cell causes damage to the cell, so it must be removed out of the cell. For that, calcium channel pump is provided. But in case of cell injury, the cell membrane gets damaged and this pump get blocked, due to which calcium start accumulating inside the cell. And thus this calcium accumulated inside the cell and the phosphate formed from phospholipid combines and form calcium phosphate, and thus dystrophic calcification occurs. Now come to the next type of calcification, metastatic calcification. Metastatic calcification means the tissue of our body is normal. There is no problem in the tissue of body. The problem is in the metabolism of calcium. That's why the blood calcium level and serum calcium level also increases. But the tissue is not necrosed, no cell injury occurs, only in the metabolism of calcium there is problem. What is the pathogenesis of metastatic calcification? As we all know, bone is a storage of calcium. So in case of excessive metabolism of the bone, excessive metabolism of the calcium present inside the bone, automatically there will be increase in concentration of calcium in the blood. And in case of excess intake of vitamin D or calcium from outside in the diet, there will be excessive absorption of calcium from the gut, and in that case also there will be increase in concentration of calcium in the blood. So let's see under what circumstances excessive metabolism of calcium in the bone takes place. In case of hyperparathyroidism, hyperparathyroidism means increase in the concentration of parathyroid hormone that is released from the parathyroid gland. Hyperparathyroidism can be either of primary type or secondary type. Primary hyperthyroidism occurs due to parathyroid adenoma. Adenoma means cancer of the parathyroid gland. And secondary hyperparathyroidism occurs due to parathyroid hyperplasia and chronic renal failure. Parathyroid hyperplasia means increase in the size of parathyroid gland, and next cause can be chronic renal failure. The other possibility are destruction of bone, due to which excessive metabolism of calcium occurs. In case of destruction of bone, there will be excessive metabolism of calcium from bone, and this is seen in case of multiple myeloma. Multiple myeloma is a type of blood cancer in which there will be destruction of bones. Next possibility can be paraneoplastic syndrome. Paraneoplastic syndrome can be seen in various types of cancer of our body. This means that in addition to cancer, there will be additional group of abnormalities present inside the cell, inside our body. Like in case of breast cancer, there will be hypercalcemia. That is a other group of abnormalities. That is an additional group of abnormalities other than cancer. And that we call it paraneoplastic syndrome. Next example can be prolonged immobilization due to disuse atrophy of bone. We can say in case of paralyzed patient or coma patient, they do not move from one part to other. They do not utilize their limbs, their bones, due to which there will be disuse atrophy, and due to prolonged immobilization, there will be deposition of calcium in their bone, and excessive metabolism can take part, due to which blood calcium level increases. Now, excessive absorption of calcium can occur under the following circumstances, like in case of hypervitaminosis D. If the intake of vitamin D is very high, then there will be hypervitaminosis in our body. And there is an inflammatory disease condition also, during which there will be increase in concentration of vitamin D, that we call sarcoidosis. Sarcoidosis is a kind of inflammatory disease that affect various organs of our body, and in this case there will be hypervitaminosis of D. Next possibility during which excessive absorption of calcium occur is milk alkali syndrome. In milk alkali syndrome, we will see either there will be excess intake of milk, or there will be excess intake of antacids because antacid has a component of calcium also present inside them. So there can be increase in concentration of calcium, and also in case of intake of calcium carbonate in case of treatment of peptic ulcer. Next one is renal tubular acidosis. Renal tubular acidosis means kidney fail to secrete acid in urine, due to which there will occur acidosis in our body, and due to acidosis there will be increase in the bone breakdown, of bone and release of calcium from the bone, and thus increase in concentration of calcium in the blood. Now come to the sites of metastatic calcification. First one is lung. In the alveolar wall of lung, there can be metastatic calcification. Next site is stomach. In stomach, in the acid secreting part of the stomach, mostly fundus, there will be metastatic calcification. Next one is cornea of our eye. And the other one is blood vessels. In case of blood vessels, metastatic calcification mostly seen in the inner layer of the blood vessels. And the other one is synovium of the joint. Synovium is actually a jelly-like substance present between the joints, and the importance of this synovium is that it reduces friction during the movement of the joints. So, synovium is necessary for frictionless movement of the joint. But in case of metastatic calcification, calcium gets deposited in this synovium and there will be very painful movement of the joints, due to which synovium is very important, because joints need synovium for a frictionless movement. These all are the important things about calcification. Thank you for watching the video. Do like, share and subscribe. Hit the bell icon for more notification of videos. Thank you.